This is Dr. Sohrab Gollogly in Monterey, California. I'd like to share the details of a case that endoscopy as a form of surgical intervention for athletic patients. This is Giga Chikadze, who's a UFC fighter, a Georgian kickboxer, and who's returning to the ring on Saturday night, 8 months after I performed a posterior cervical laminoforaminotomy for an acute disc herniation at the C6-7 level. Here's the moment in the fight where he sustained the injury. After kneeing his opponent in the face and then running in to finish the fight, he got kicked in the chin and sustained a C6-7 disc herniation that created a lot of weakness in his right upper extremity and depowered his jab for the rest of the fight. He battled his way to a split decision and then got this MRI scan. So here to walk you through the MRI scan, this is the sagittal image over here on the left. This is the back of his head here, back of his neck here, front of his throat here, and chin here. This is the C2 vertebral body here, 3, 4, 5, 6, 7. And you can see the hint of the disc herniation at the C6-7 level. But if we turn our attention here to the axial image, which is a slice through him like this is him lying on his back, looking up at the ceiling, and we're standing in his toes, looking towards his head. So this is the right side of the spine over here and the left side of the spine over here. Seen in cross-section, here's the spinal cord sitting inside the spinal canal, surrounded by cerebrospinal fluid, which is this white fluid that bathes and protects the spinal cord. And at every level of the spine, a pair of nerve roots are going to branch off of the spinal cord and travel through the neuroforamen out into the arm. On the right side, there's an acute disc herniation here at the C6-7 level, which is trapping the C7 nerve root and causing the weakness and the loss of power in his left upper extremity. So we'll move now to the operation itself. So we have this patient under general anesthesia in the surgery center. He's in the prone position. This is done through a 7mm incision, so a tiny incision, just big enough to fit a scope about the size of a fat number 2 pencil. Here we're using a high-speed drill to enlarge the natural opening into the spinal canal, and then a Kerrison rongeur to resect a couple of millimeters of bone. So there's really no disturbance at all to his normal anatomy, and it really preserves the power and the strength of the posterior spinous muscle because there's no significant scar tissue formation. Now we're using a ball tip nerve hook to move the spinal cord medially in order to expose the disc herniation, and then fish the actual disc herniation itself out with the same ball tip nerve hook. So here comes the fragment of disc material here that was squeezing the nerve root. We'll hit pause here and just illustrate how this is the edge of the thecal sac, which contains the spinal cord, and then the nerve root, the C7 nerve root, is coming towards us like this, and it's being impinged in this direction by this fragment of disc material, and we're picking out that piece of disc material. So he made a great recovery. He was able to return to training within 4 to 6 weeks in terms of cardio, and then back to grappling and sparring within 8 to 10 weeks, and now makes his return to the UFC on Saturday night against his opponent 8 months after his previous operation.